Good morning, all the audience. I'm Dr. Nantaphon from Pattaya University Hospital. Today, we talk about defining massive rotator cuff tear. Is there any consensus? There are many classifications of rotator cuff tear. All of them has the very same purpose, easily understandable among surgeons, easily applicable in practice, reproducible and communicable, identify the pathology and can give a prognosis, can be a treatment guidance, and compare the outcome. To serve this purpose, there are many types of classification: tear depth, tear size and extent, tear retraction, tendon quality, tear progression, and arthroscopic classification. Today, we will focus on tear size to define what is massive rotator cuff tear. My talk will be divided into 4 parts. First, we will talk about what the word definition is for, why it's important. Then we will look into the old definition, their problem and adaptation. And lastly, is there any consensus? We use the word definition to express the essential nature of something. Good definition allows us to have a common understanding of something we want to discuss. And today, of course, massive rotator cuff tear. From Cambridge Dictionary, the word massive is mean very large in size, amount, and number. So we use the term massive rotator cuff tear to identify very large tear that difficult to repair and has an uncertain prognosis. In the past, there are 3 definitions of massive rotator cuff tear. From Caulfield, 1982, Nobuhara, 1994, to Gerber in 2000. Caulfield first categorized the size of the tear to be 4 types. Less than 1 centimeter is small, 1 to 3 centimeters is medium, 3 to 5 centimeters is large, and more than 5 centimeters is massive. Then in 1994, Nobuhara said that massive rotator cuff tear that diagnosed by their configuration or by the diameter is not accurate picture, and proposed that parameter of the degree of exposure of the humeral head is better. This is calculated from the length of the awal tendons multiplied by the height of the torn tendon. For the length, we measure from anterior to posterior, and for the height, we measure the retraction of tear. We multiply these 2 values and count as massive rotator cuff tear when it's more than 5.5. In 2000, there is still no universal definition of massive rotator cuff tear, so Gerber tried to propose one. He said that patients with this lesion should have a chronic pain, weakness, functional impairment, and often resist to non-operative treatment. His proposal is rotator cuff tear will be defined as massive when at least 2 entire tendons detach from their insertion. This is a conclusion of old definition, more than 5 centimeters from Caulfield, humeral head exposure from Nobuhara, and more than 2 entire tendons detached from Gerber. All of that old definition had a problem. In 2015, Lederman pointed out that old definition all apply at the time of surgery. No pre-operative MRI-based definition. He also showed flaw of Gerber definition that with that time arthroscopic technique, Gerber definition not reflects difficulty and irreparability. So he modified the Gerber definition by adding that one of the 2 tendons that detach must be retracted beyond the top of humeral head. Because of lack of a universal definition and inconsistency, lead to discrepancy in retear rate, widely from 17.8 to 94%. So in 2017, Oak also tried to improve Gerber definition by dividing it into 3 types for more clinical relevance: anterior superior, posterior superior, and anterior posterior. But unfortunately, this had no new or better definition, no universal acceptance. For all the definition and still no universal consensus, maybe the problem is not the definition of massive rotator cuff tear. Maybe it's from the word's definition itself. Because every definition must be made in terms of other concepts, so that it's impossible to define anything perfectly. What best we can do is try to find the most acceptable definition. That's why in 2019, 20 doctors from 16 institutes in United States doing a consensus with Delphi techniques about definition of massive rotator cuff tear. Delphi technique is a series of surveys that participants send an answer back and forth in series of rounds. After each round, participants can see the result. Process continue until desired consensus is achieved. This study utilized a modified Delphi process with 4 rounds over 3 months. Here is an example of the survey. They divided the survey into many categories: defect size, number of tendon tear, tear chronicity, degree of medial retraction, and pseudoparalysis. And they also asked about importance of the previous definition: tendon retraction to glenoid rim, complete tear of 2 tendons, complete tear of just only 1 tendon, and incomplete tear of another one. Here is the result of the first round survey. As you see, more than 90% think that tear size is important. Retraction to glenoid rim and diagnosis by MRI or intraoperatively is also taken into account. After all the process, they concluded the definition of massive rotator cuff tear to be: first, tendon should retract to the glenoid rim, measured in either coronal or axial plane. Second, more than or equal to 67% of the greater tuberosity exposed, measured in the sagittal plane. These two definitions can be combined with each other or just only by itself. And last one, the lesion must be diagnosed with either MRI or intraoperatively. In conclusion, we define massive rotator cuff tear to reflect very large tears, difficult to repair, and has an uncertain prognosis. Because of this purpose, the definition will change time to time depending on the improvement of the surgical technique, instrument, and implant. So for the question of this topic, is there any consensus? The answer is yes. The newest consensus is from the United States. Retraction of the tendon to the glenoid rim, more than or equal to 67% of greater tuberosity exposed, and diagnosis with either MRI or intraoperatively. But it's not universal consensus. There's still no ASSA, no KSES, no TOSSM, and no universal consensus yet. Thank you for your attention, and hope to see you next year. Thank you.